Traveling when you have a special needs cat can feel completely overwhelming. But what if boarding was more than a place to stay? Some facilities offer full medical boarding with veterinary monitoring. This goes beyond basic care to include precise medication administration, managed by trained professionals. It's a system designed to provide expert care, giving you true peace of mind. Here, we'll break down exactly how these facilities handle everything from chronic illness to behavioral issues, and what you need to know. First, what does special needs even mean for a cat? It's a wide spectrum: chronic illnesses, mobility issues, strict diets, or behavioral problems. Reputable facilities don't guess. Their process begins with a detailed intake, gathering your cat's entire medical history and daily routines. This isn't just a simple form. It's a comprehensive document that guides every staff interaction with your pet, creating a personalized care plan. But a plan is only as good as the people executing it. These facilities employ staff specifically trained to handle diverse special needs. Their training focuses on proper, low-stress handling for everything from giving pills to assisting a cat with arthritis. This expertise is fundamental, so they have the plan and the people. But how does this system work for specific complex conditions? Let's take a serious case: diabetes. It requires precise timing and monitoring. How can a boarding facility possibly manage that safely? The answer is in their protocols. For diabetic cats, specialized boarding is proactive, including real-time glucose testing to keep levels stable. Beyond monitoring, staff are trained in trauma-free insulin injections, minimizing the stress that can affect glucose levels and prevent fluctuations. This proactive approach extends to behavior. For anxious cats, the controlled, structured environment can actually reduce stress triggers. It's not just a quiet space. Trained staff actively identify a cat's specific triggers and implement management techniques to prevent anxiety. This level of detail applies across a huge range of needs. Let's look at some more examples. For cats with arthritis, they provide cushioned bedding and even carpeted stairs for easy access. For kidney disease, care includes critical hydration support and specialized renal diets. For blind cats, the room layout is kept stable, and staff use familiar scents to provide security. For deaf cats, the focus shifts to visual communication and predictable routines to prevent startling them. The level of customization is impressive. So what does this mean for you, the owner, when you're choosing a facility? First, understand that there are different levels of service. Some facilities offer premium TLC suites with 24-hour care for geriatric cats. This specialization, naturally, comes at a cost. Be prepared for extra charges for administering multiple medications or preparing complex diets. You'll also need to provide documentation. Facilities require proof of vaccinations and an established relationship with a veterinarian. So, to answer our earlier question about the diabetic cat, safety is managed through this combination of detailed planning, trained staff, and specific protocols. Now that we've seen all the individual components, let's connect them. How do they create a holistic system that truly works? Recall that detailed intake plan? That's how staff knows to provide carpeted stairs for the arthritic cat or keep the blind cat's room layout consistent. Even your role is part of this system. When you bring a familiar blanket, staff uses it as a tool to manage anxiety and provide sensory continuity. This brings us back to the idea of medical boarding, where the plan, staff, protocols, and environment converge to provide clinical-level support. Therefore, choosing the right facility isn't about finding a pet sitter. It's about engaging a temporary healthcare partner for your cat. As we've seen, the right boarding facility doesn't just accommodate special needs. It is built to actively manage and support them through a system of care. This system allows owners to travel not with anxiety, but with the genuine peace of mind that their beloved pet is in expert hands. When you research a facility, ask 2 critical questions. Can you walk me through your intake process? And what specific training does your staff have? Because finding the right care means you can both rest easy while you're away.